Out that door and back around, so I'll talk fast. Everybody's pretty hungry. Dr. Constantino, yeah, so we met her to teach this kinesiology class, and it sounded okay. And we're like, okay, great, when do we have to start? She's like, next week. I'm like, next week? So we put together the class on the fly that first semester, which was pretty tough, but we knocked it out, and it's super fun to teach. All right, I'm going to talk about, and Dr. Anderson, I'm going to talk about elbow pain. Simple stretch about elbow pain to keep you guys healthy. So yeah, I have a clinic here, and I teach at the university. When I was growing up, there was a game show called Let's Make a Deal. When I was growing up, I had a black and white TV with 7 channels, not 700. And one of the shows that I remember was Let's Make a Deal. And how this show goes is at some point during the game show, the contestant has to choose between door number 1, door number 2, door number 3. And like one was like a new car, one was like a cow or something. It's pretty funny. So the theme show for tonight's talk in 3 minutes is Let's Make a Deal. So elbow pain can be a pain in the butt, can be very debilitating, can be very chronic. I've found there's typically 3 reasons why somebody has elbow pain. Door number 1, what's behind door number 1? Let's see. Well, it's the muscles and tendons. Muscles and tendons of the elbow, they kind of start here and they go all the way to the wrist. Oftentimes people can have elbow pain on the outside part of their elbow, and typically it's from carrying bags or putting their hand in this position, this kind of extension of the wrist position, and they're in this position kind of all day long, and it kind of flares up the tendons a little bit. So typically, to get that kind of pain better is just putting your arm out there and just stretching your wrists back that way. Go ahead, everybody try this. Do something while you're there. Yep, and just feel that stretch in your tendons of your elbow and your forearm. So if you have tendon elbow pain, that's usually going to do the trick. So let's check behind door number 2. Door number 2, we have where it's more the joint pain or some ligament pain. People spend a lot of time in flexion of their elbow. Flexion because they're eating a lot and doing a lot of things here.
Girls and girls.
And sometimes.
We know who you are.
And on occasion, you can get a ligament injury of the inside part of your elbow. And after your elbow hurts, you hold it in here a lot and you're here a lot. You rarely are doing this a lot. You don't see people doing this all day. They're kind of protecting their elbow. A lot of their activities encourage flexion, getting dressed, flexion. So one of the strategies for fixing joint pain for the elbow is more of a extension stretch. So if you guys can put your arm all the way straight and grab the inside of your palm and kind of go all the way straight and force that thing to be all the way extended that way, that seems to help a lot of the elbow pain. You can put your arms down. One of the things that we do here is if you're doing a lot of one thing, maybe stretching the opposite way is going to be helpful. If you spend a lot of your time sitting in chairs all day, maybe the opposite way is going to be helpful doing that. So that's a stretch if you have kind of joint or ligament pain of the elbow. And door number 3, we have Dr. Anderson to see what's behind door number 3.
Thanks, Doc. It was a great lead-in. I appreciate that. Corey, my lovely assistant, come over here and have a seat. So this is to piggyback a little bit on Christy Grayson's talk about differential diagnosis of the shoulder. There's also differential diagnosis for the elbow. We talked about cervical radiculopathy and the nerve sending messages down the arm. Typically the messages aren't really very nice. It's usually pain, loss of sensation, paresthesia, doesn't make pain and stuff like that. So one stretch that might help if you have some of this cervical radiculopathy that's affecting the elbow region might be actually stretching the neck. So I'm going to demo here on Corey a cervical retraction stretch, and then everybody can practice it themselves. There's a specific technique to it, so sit up nice and tall. And the chin should remain neutral, and you can either grab your chin, you can cup it, you can grab it, and you can do this. If you want to get an even deeper stretch, go ahead and grab your chin there, Corey. And then lift the elbow up, because you want to drive perfectly horizontally while you do the cervical retraction. Your chin should not go up, it should not go down. Your vision should remain horizontal all throughout the stretch. Go ahead and push. And then relax. And then push. And then relax. Now everybody try that on themselves. Good posture. Chin should remain neutral. Vision horizontal throughout the stretch. You should have a nice excursion on that cervical retraction. And sometimes, miraculously, this makes elbow pain go away. Thank you so much, Corey. Thank you, everyone. Now we are going to eat. And how we're going to do it is